Welcome to Health and Safety at Work training, created by Domiciliary Service. You will need notebook and pen, and obviously some concentration, good listening skills. Okay. The Health and Safety at Work Act was created in 1974 to ensure that employees were taken care of at work in way of safety. Also, anybody else that would come into an environment which we would class as work were also safe, so visitors to an environment, and ensuring that if there were any obvious risks in any work environment, they were controlled. It started very sadly with a whiskey factory in Scotland where there was bars on the outside of the windows to ensure that robberies were minimised of the business, which obviously makes some sort of sense. What didn't make sense was one day when one of the tanks exploded and there was over 80 workers inside, nobody could get out of the building, and that was when the Health and Safety at Work Act was created. What could class as a health and safety concern when you're working with the Domiciliary Service? So obviously we're in lots of people's different houses and people do their own thing, they have their own lives set up, they have their own things around, so their pets might be a trip hazard. The appliances they use might not be as safe as the ones you would have at home. They might have beautiful rugs lying all over the place, which are a trip hazard. Medication might be all over the place, which is likely with our clients, you know. They've lived in these houses for years, their driveway could be an issue. The client themselves, very sadly, we look after lots of people with complex issues, and the client themselves could easily be the risk to you. So what we do as a company is we try and make sure that we assess any risks that are going to be present when you're at work. So that includes movement and handling plans surrounding handling your client, making sure they're safe and so are you when you're providing their care. Cost assessments, so if you're doing any cleaning, we're controlling any potential hazardous substances you might be using. Bleach, routine cleaning products. Medication goes without saying, that is a big risk factor with our clients. They are temperamental with their medication a lot of the time. They feel they're independent and often they need our support quite drastically. That is definitely something where we would need to implement risk assessments, especially with controlled drugs and things. And obviously any other specific concerns that we might have with a client, there might be something to do with their personality, something to do with their diagnosis, something to do with their specific environment that needs risk assessing. So the 5 steps of risk assessment are: we need to identify the hazard, identify who is at risk of that hazard, evaluate the risk, decide on methods to control and reduce it, and then review it when we've done that, and hopefully we have a positive outcome which reduces and minimises any area of risk to anybody. So who do you think risk assessments support to keep safe and well? Pause this video for a minute, make some notes. In domiciliary care, there's lots of considerations we need to take additionally to lots of other health and safety environments. The biggest concern for me is lone working, because although it's a very close-knit team and we work very, very strongly together, it's inevitable to acknowledge that really when you're out at work, you are by yourself, practically and physically, the majority of the time. So lone working, what risks have we got if we're lone working? The fact that you're literally on your own, so there's nobody else to help you if you came into a critical situation. And you're in places where you might not be really familiar. You might be going to a new client, to a new home, and you don't know where you're going. It could be winter, so it's dark at 4 o'clock in the evening. We need to take some very sensible steps to making sure that you're safe. And when I say we, it's the royal we, because I'm referring to you as well. You need to take some very sensible steps to keeping yourself safe when you're working. So if we're focusing on lone working, some very obvious tips would be to keep your mobile phone charged and on. And it always should be. This is your company phone which you're required to use when you're out at work. Tag in and out of each call so we know where you are and we can pinpoint when you left somewhere, so then we can predict where you're going to be and at what time next. Wear sensible, practical clothing. So you've got your works uniform, but in winter, wear something which holds some reflective quality. Make sure you're in a warm coat. Make sure you're wearing sensible shoes. So if you are in any situation where you need to protect yourself, you're able to do that. And even when I'm saying protect yourself, it could be against an uneven driveway in the dark. You need to be wearing sensible shoes to be able to tackle things like that sensibly. Make sure you look at the notes on your client's log. Make sure you know what you're doing, what you're expected to do when you're there. Reference the care plan. Have a look. Get used to the environments you're going into, even when you're not there. And don't take unnecessary risks. The on-call phone is on out of hours, so even if you think the office isn't open, somebody is always there to talk to you when you're out at work. So ring and ask if you're unsure about anything. Don't leave anything up to chance. Your uniform is really, really key because it gives visible identification of who you are and what you're doing. You need to be wearing your EDS t-shirt, jumper, gilet, coat, tabard, something that identifies you straightforwardly in your uniform. You always need to be carrying your ID badge. That's absolutely vital, not only for your safety and reassurance, but for that of the clients. If you're knocking on a door and you've never been to this client before, it is only fair that they can feel secure letting you in the property. Show them your ID badge. You're a professional care worker. You should be carrying your professional identification. Wear appropriate bottoms and shoes. So no ripped jeans, no open-toed shoes, and obviously no shoe that carries a heel. You're doing practical work, manual work a lot of the time. As I say, you need to be prepared for that yourself. And it goes absolutely without saying that you wear your full PPE. So whatever is within our infection control policy and our PPE policy, we expect it to be worn. We provide it. We give great opportunity for you to restock your own stocks. We've got emergency stocks which we can provide to you out and about. There is no excuse not to be wearing your full PPE. It's absolutely paramount you do, and there is very serious consequences if you don't. That's for your own safety and for the safety of the client. Effective PPE has proven to be really effective. So, along with your PPE, and talking about what you wear when you're at work, this is where I encourage you all to apply some common sense. It wouldn't be sensible to try and carry out a care call wearing high-heeled shoes. It wouldn't be sensible to start your morning work on a snowy day wearing pumps. You need to make sure that you are taking sensible steps to protect yourself. We will do our best at Domiciliary to provide you with the equipment you need within your client's property, outside your client's property, to undertake your work safely, but we do fully expect common sense to be a very basic part of what you do. So, accident prevention. An accident is defined as any unplanned event that results in injury or ill health of people, damage or loss of property, plant, materials, or the environment, or of a loss of business or business opportunity. What we do if we have any incidents or accidents is we record them in the accident book. The reason we do that is so we can look at how severe the risk is, we can see if we could have done anything to prevent it, and we can certainly begin to assess it to prevent anything happening again in the future. That's why it is so important. It helps us prevent anything happening again. So it's like our risk assessments. It's always trying to think, well, what can we do to minimise this happening again? How can we keep everybody as safe as possible? If you are involved in an accident at work or an incident, you will be required to report that. Now, you do that by contacting the office, and we can go through that with you verbally. We may ask you to come into one of the offices and write a statement or sign your name to one, and that is just our standard policy. It enables us to ensure that our documentation is as effective as possible. What we really expect and hope for is that you can all support us to prevent accidents as well whilst out and about. And the way we want you to do that is to say what you see. You don't all have to be qualified risk assessors, but again, we're back to that common sense. We like to know that you are recognising something that poses a risk and you bring it to our attention. There might be the back steps at a client's property which to you seem slippy or too steep, and you need to report that to us. You might be the only carer that has made that report, but if you have noticed it, then it's been noticed. We all see things differently. We're all different. So we want to know your opinion on what you think classes the risk, so we can make sure it's minimised for you and for the clients and for anybody else visiting that property. What you see might apply to another, so it's always worth raising it. We have our own policies, obviously, surrounding health and safety, which you will have received or about to receive in your induction if this is not your refresher session. And we expect you to read that and understand what is within our domiciliary policy surrounding health and safety. There are obviously lots of visual signs to health and safety. You'll have noticed them out and about, even on holidays in a hotel. Sat in a cafe, you'll see a fire escape sign, or you'll be waiting for your coffee and you'll see at the back of the tap says a warning, this water is so many degrees hot, warning. There's all these helpful warnings when you're in an establishment. The challenges we have in community home care is clients' homes are not badged up with warning signs. There isn't a flashing light above the best fire exit or a sign which warns you that the water out of the tap is incredibly hot. So again, common sense, you need to be applying that. You need to take caution. These are environments that you in the first instance are not familiar with, so please approach everything with caution. So if we're thinking about you and health and safety, or just safety, could you at home know where your water stop tap is? Could you turn that off if there was a leak in your property? Could you turn off the gas if you could smell gas at home? And could you find the fuse board if an appliance had tripped out your fuse board? Because they're the sort of basic things that we all need to be wary of when we're out and about with our clients. In an emergency situation, you might be required to locate those places. Now, we as a company already ensure they're located and they're noted and they're within the care plan, the risk assessment section of the care plan. So if ever you are in that situation at work, the information is available to you. But the point of this slide is just to be mindful of yourself, be aware of yourself always, and maybe have a think about that. Could you do that for yourself at home? So remember, always flag up any concerns. Ideally when you're still in the property with the client, because if we're going to give you advice, we can do that as and when you're there. Always ask for that advice if ever you're unsure, and always report any accidents, incidents or near misses, basically anything that you think could be